You're walking.
My name is
Also
Brooke
with your
Massengale, and I am going to
one
be
side or the other,
demonstrating
you're
ambulation
going
of the
to,
patient
make
with
sure that you're standing
one
on
nurse.
each
I
side
am
of your
going
ambulation.
to make sure that I follow my agency's policies and procedures, safety precautions, and good hand hygiene. So when I come into the room, I am going to wash my hands with warm water and soap for at least 30 seconds. I'm going to apply my gloves before coming into contact with my patient. I'm going to come over to my bed, use my 2 patient identifiers to identify my patient. I'm going to introduce myself. Hi George, my name is Brooke. I'm going to be your student nurse today, and let him know that we are going to be ambulating. So I've got my gait belt. I'm going to make sure that this is tight, not too tight to cut off circulation, but that I can still get a couple fingers in there for him. I'm going to make sure it's in the right placement. Okay. All right, and I'm going to make sure that the head of my bed is up to assist in George getting up. I'm going to ask him to bend his knees for me, and I am going to put him on his side and let him pull his legs over and help pull him up if he needs it. And then I'm going to let him dangle for a few seconds, however long he needs. Ask him if he's feeling dizzy or lightheaded. If not, we're going to continue. And I'm going to put my hands in the gait belt. I'm going to instruct George if he needs to put his hands on my waist and on my shoulders to make sure that there is no injury to myself or George. And then on the count of 3, I'm going to stand him up. So 1, 2, 3. I'm going to make sure that my knees and his knees and my feet and his feet are aligned. We are going to, if he has an IV pole, I'm going to put it on the left side. I'm going to make sure that I am standing on his weaker side, behind and beside him, if we are ambulating, and that's it. Okay, now we are going to be ambulating our patient with 2 nurse assist. We are going to make sure that our bed is in the lowest position and that our wheels are locked before moving the patient. We're going to apply our gait belt, make sure that it is not too tight, but that we can still get 2 fingers in. And then we are going to have the patient bend his knees up. We're going to pull him over to his side and pull his feet down. We're going to sit him up into a dangle. Make sure that he acclimates himself to the floor before we move him. And then on the count of 3, we are going to be lifting our patient. 1, 2, 3. And then we are going to, if I have an IV pole, we will make sure that we are using our outside hand to ambulate the patient with the IV pole. And we always want to make sure that our patient has non-skid slipwear or footwear. We are going to be adjusting our crutches to our patient's needs. So what we're going to start with is we're going to have the patient lie down, and we are going to measure from the heel to the axilla, and we are going to add 1 inch. And then after that, we are going to have the patient stand, and we are going to place the crutch 4 to 6 inches out and make sure that our our pad for our crutch is 3 fingers below the patient's axilla. And then we are going to make sure that the hand rests, that the elbows are slightly flexed, that they're not just straight, and that it's comfortable for the patient. And we are going to make sure that the pads do not go up underneath of the axilla. I'm going to be demonstrating the tripod position with my crutches. I'm going to make sure that they are 6 inches out in front of me and form a triangle with my feet. To be demonstrating my 2-point with my crutches, which I'm going to be advancing my right foot with my left crutch and my right crutch with my left foot, and then I'm going to be demonstrating my 3-point. So I'm going to bring my crutches forward and then my weight-bearing foot forward, and then I'm going to bring up my non-weight-bearing foot. So I'll repeat: crutches, good foot, and then non-weight-bearing. I'm going to be demonstrating my 4-point, which is I'm going to bring my right crutch forward. My good foot is my left foot. I'm going to bring it forward, and then I'm going to do my left crutch and bring my back foot, which is my non-weight-bearing foot forward. Now I'm going to be demonstrating my swing 2 with my crutches. I'm going to make sure my crutches are in my tripod position, and I'm just going to swing both feet to my crutches. I'm going to be demonstrating my swing through, which I'll have my crutches in my tripod position, and I'm going to put my weight and I'm going to swing through my crutches. Going up the stairs, you want to instruct your patient to lead with their good foot, bring up their bad foot, and then their crutches. So you'll go good foot, bad foot, crutches. Okay, when coming down the stairs with the crutches, you want to instruct your patient to put both crutches down to the next step and hop down, and just keep going until they're at the bottom of the stairs. I'm going to demonstrate how we are going to walk the patient with a cane. When measuring, you want to make sure that the cane is 4 inches away from the foot, and that the top of the cane hits the greater trochanter. And then we also want to make sure that we are using the cane on our strong side and that our elbow is flexed at a 30-degree angle. And then we will advance our weak side with our cane, and then we'll bring our strong side forward. Now we are going to demonstrate walking with a walker. When measuring, you want to make sure that the top of the walker hits the greater trochanter and that your elbows are flexed at a 30-degree angle. And you want to instruct your patient to move the walker forward, not too far, and then walk into the walker.
There could be a little dealy thing.